This tooth has deep internal damage affecting the pulp, but it may still be saved with root canal treatment. The dentist evaluates the tooth to determine whether root canal treatment is the best option. The infection is located inside the tooth, where brushing and antibiotics alone cannot fully remove it. The dentist evaluates the tooth to determine whether root canal treatment is the best option. A small opening is created so the dentist can safely reach the infected pulp. The infected pulp is carefully removed from the inside of the tooth. The endodontic file gently prepares the root canal, while an irrigant flushes away debris, creating a clean and anatomically accurate space for obturation. The canals are thoroughly disinfected and dried before they are permanently sealed. The clean canals are permanently sealed to help prevent future infection. The opening is restored to rebuild the strength of the tooth. Many back teeth benefit from a protective crown after root canal treatment to improve long-term strength. The bite is checked to ensure the restored tooth functions comfortably. Regular brushing, cleaning between your teeth, and routine dental visits help protect treated teeth.